working on the Surviving Sepsis campaign. I want to talk with you today about spreading a change. And the first thing that I would like to address is how to tell if the change you've been working on is spread ready. And Everett Rogers wrote a great book called The Diffusion of Innovation that informs a lot of our spread thinking. And he has a suggestion on how to evaluate changes. So the first thing that Everett Rogers says is we should think about the change as being spread ready if it's something that another person could observe, if it's something that's trialable, so I could try it out, does it have a relative advantage over how we do things now, and is it relatively simple to adopt and fairly adaptable with how we do things now. So I've seen people in my practice take these 5 questions and with the change they're considering spreading, rating that change on a scale of 1 to 5 against each one of these factors. So how observable is it? It's a 5. How trialable is it? Well, it's a 3, because if you haven't made the electronic medical record change, maybe you can't trial it out. Its relative advantage, oh, it's a 5. It's great. Is it easy to adopt? Well, maybe it's a 4. It's going to take some training. Is it adaptable with how we do things? Is it kind of sort of like how we do things now? Yes, it's 5. And so you would add those scores up, and the advice that we always give is that if you don't have a score of 15 or higher, an average, if you're rating on a scale of 1 to 5, you may not be spread ready, and wherever your weak scores are would point you to the area that you need to work on to improve your change. So that's one way I've seen these 5 criteria used. But again, Everett Rogers says, can I see it? Can I try it? Is it better than how we do things now? Is it simple enough to do that I can do it? And is it sort of like how I do things now? So I was thinking of the example of the cell phone. And we've seen the adoption of cell phones in our generation. Definitely, it has a relative advantage over the old way where we were tethered to a landline. Is it simple enough to use? Well, I always think it's simple until I buy a new cell phone, and then I have to go through a little training period. But it is pretty simple to use. It is adaptable, so it's something that is like the way I use a real phone. In other words, there's a keypad on it, and the numbers are arrayed in the same way as a keypad on a telephone. And I dial the number, and I have something that I hear in my ear and a microphone. So it is like using a landline in a sense. Is it trialable? Well, I remember that I might have been the last person in the universe to get a cell phone, and so I could try it and use my colleague's cell phone, and it was great. Observable, I could see people all over the world using it. So Everett Rogers says, when these criteria are met, something is spread ready. And when I think back to cell phones, they spread like wildfire. There's other examples we could think of, MP3s. Remember, we used to have Walkmans, and before we had Walkmans, we had these CG players, big old CD players, and before that, little transistor radios. So, you know, we've seen a lot of adoption of technology, social media, and that actually is pretty compatible with Rogers' theory. So you might say, okay, Jane, that's great, cell phones, so what? But let's take an example out of our sepsis work. So right now we're working on a sepsis project where we want medical surgical units to screen patients for early identification and intervention if they have sepsis. So if a nurse is suspecting sepsis, one of the changes that we've been working on in this project is developing nurse-driven protocol. And so in that case, if a nurse suspects sepsis, the protocol allows her to go ahead and order a lactate and to begin a fluid bolus while she's communicating with the physician and waiting for the next order. So this is a change. And we have to ask ourselves, is this change trialable? Well, yes, we definitely are testing it to see how it works and to learn from it. Is it observable? If someone from another unit came onto my unit, could they see me doing this? Absolutely, they could. Does it have a relative advantage? Well, we think so, because getting that lactate ordered gives the physician a lot of information to make the next decision. And the fluid bolus is a definite relative advantage over not doing something. Is it simple enough to do? Well, you would think so. And because nurses are accustomed to having nurse-driven protocols, and they're accustomed to ordering things. And in that sense, too, it's adaptable to how we do things now, because every nurse is accustomed to taking orders and also notifying physicians. So we think that this change actually is spreadable once all the kinks have been worked out. So what I wanted to share with you today is just a short module on how to understand if the change you've been working for is ready for scale up and spread. Thank you. Good luck with spreading change.